Are you in nursing school or you want to be a nurse, but the fear, anxiety is keeping you awake and cannot deal with it? I always say nursing, we have diverse ways one can practice as a nurse. You don't have to be a only bedside nurse. Today I'm just going to address you that you can choose so many fields as a nurse. You can be a case manager that just talk to patient, and that's easy. Grab your tea and your chair and let's discuss something you can do as a nurse. Thank you. Hello, this is Dr. Tina right here. Happy Valentine's Day to you and everyone out there. Today is just a short video I have for you, and I'm just going to discuss about how to know that this is the place you want to work as a nurse, NP, or what have you. Because many people go into nursing without knowing exactly where they want to work, and then they get so disappointed and they quit. But I'm here to help you not to quit, but to make a decision that will help you. If let's say you are in nursing or you graduated and you are working, one thing I learned personally is that I found that there are certain places that I cannot work when I was in school. I quite remember they sent me most of my clinical rotations, I did it in ICU. The place or the ICU that I was trauma. It was the only ICU in that hospital. And so they received everything. But I noticed that I cannot work in ICU. Why? Because I cannot take trauma. I cannot help seeing the traumatic incidents because I found myself emotionally drained and I was crying all the time. And also I realized that I cannot deal with wound. And so in my career, I decided not to do anything that is about wound. If it's a small wound or something, stitches, all those kind of stuff, I can take it. But I saw some wounds that I realized that wound care is not my actual field, or I cannot take it. I can't deal with that because I get myself clenched and emotionally drained and crying. So I realized that wound care and also traumatic ICU is not something I can deal personally. Sometimes time to learn how to deal with certain things, but I realized that traumatic ICU is not something for me because I've seen that most of my patients were not talking to me because they are either on ventilator or waiting to die or critical issues, and I found myself so emotionally drained. Even I was in a meeting where we have to address the family that we're going to take this support from their family member. I couldn't take that. I cried throughout. I couldn't. And so I realized from the get-go that ICU won't be a place for me. When I graduated and I started working, I worked in so many specialties like neuro, orthopedics, typical med-surg, renal transplant, dialysis. And I realized that I'm able to deal with all these fields. Even though sometimes I see wound, I dress wound, but it's not like a typical wound or something I have to do every day. Even though I clenched, but I try to do it because I'm not going to do it forever. But I realized that I cannot specifically deal with only wounds. And so it's not something I pursue as a wound care specialist or getting a certification in wound care because I know myself that I cannot deal with that. So all I want to say is that there are so many fields in nursing that one can go and do it. If you think home health is better and it's something that you can deal with it, I believe that it will help build your career, so go for that. Some people will say, I hate driving. I cannot drive around, so they cannot deal with a home health, and that is understandable. Don't go choose home health job. If you are somebody who say, oh, med surg, I can't deal with poop, I can't clean patients all day, I can't be 10, I don't think long-term or med surg is for you, because you're gonna deal with people that stay over a long period of time in the hospital, and mostly they are in med surg unit. But if you are somebody who loves to talk to patients, interact with patients, help patients with their needs, such as cleaning them, turning them, and also dealing with your co-workers, then med surg is for you, even though it's tedious, maybe sometimes, but you will find yourself liking it. If it's a neurology, I worked in a neurology as a nurse student and also a nurse practitioner, and I realized that I like neuro, so I can deal with people with neurology issues. And so you do that. If you are a nurse practitioner and you think that you cannot deal with children, then you will select something like adults, where you will deal only with adults. So in your specialty, you can go for certification in only adults. If you're somebody who cannot deal with mental issues because it can't deal with psych, so maybe it's not for you. But if it's for you, you like talking to people, addressing issues like that, then psych is for you. If you're somebody that cannot deal with adults as a nurse practitioner, then you can choose to deal with kids. Then you can go into pediatrician. If you want to deal with only women, like women problems like OBGYN, then you can go deal with women. So what I'm trying to say is there are diverse specialty one can choose as a nurse. You don't have to be a med-surg nurse when you cannot be. You don't have to be ICU nurse when you think you cannot. But in nursing, generally, you select a place you can work and they will help build your career and be successful. If you know that bedside is not for you, and then you can deal with something like administration. I have seen the administration, some people cannot take it. They go in and they quit because they cannot deal with everybody's problems. And then, but if you can deal with everybody's problem, addressing issues between colleagues, co-workers and all that, administrative work, then you can go in and do managerial positions. Or so it's not, I always stress that nursing is not only about med-surg or bedside. Nursing is so many. You can teach. If something you love to do, you can teach. You don't want to deal with patient care, then you can choose to be a teacher, educator. So don't lose hope. Just choose something you like in nursing. Don't just go in because you want to be a nurse. After you graduate, then you choose specifically where you want to work. I hope this helps. Stay blessed and make a good decision in reaching your career. Remember to subscribe and click the like button. Thank you. Have a blessed day. Bye.